Good morning and thank you for joining us today. Teresa is not here today for the YouTube session. I will now report our case count. We now have a total of 12,470 cases, an increase of 21 cases from yesterday. 2 cases are outbreak related, 3 are community acquired, 2 are close contact of confirmed cases, and 14 are still under investigation. We now have 263 cases that are currently active. Unfortunately, 352 deaths have occurred in our region, an increase of 2 deaths from yesterday. A man in his 90s from long-term care home, and a man in his 70s from the community. I want to express my condolences to these families who lost their loved ones. Right now, 40 cases are currently hospitalized, 13 are in ICU. There are currently 19 active outbreaks across Windsor-Essex. 8 of them are in the long-term care home, 8 are in workplaces, 2 are in community setting, and 1 is in a hospital setting. With respect to vaccine, we now have a total of 19,334 doses that have been administered in Windsor-Essex area. 4,538 Windsor-Essex residents have received the first dose. 7,398 Windsor-Essex residents have received both their first and second doses. I will now turn on to my epidemiological summary for today. Okay, so starting off from a global perspective where we are, and we can see that the COVID cases are starting to decline in majority of the countries, and Canada, we have seen a surge, and now it's coming down quite significantly with the cases reducing in every parts of Canada. Similarly, when we are looking at the daily new confirmed deaths, we're starting to see some impact, and the number of deaths in our country is going down as well, not to the level we would like to see. So still there is some work to do in terms of reducing the case counts, but overall it's moving in the right direction. Focusing just on Ontario, as we can see, we have seen a huge spike with cases going all the way up to 4,000 cases a day, and now we are dropping down to close to 1,000 cases a day per day, and overall on an average we are still slightly above the 1,000 cases mark, but we have seen even yesterday the case count went below 1,000 cases. Looking further in Windsor-Essex, this curve is showing the overall cases as well as the 7-day moving average. And what we are seeing is an ongoing decline in the number of cases, which is a good sign for our community. And what we are seeing is the effect of all the good work that our community has done as part of the lockdown, as part of the stay-at-home order, and we hope to see that we will continue to bring these cases at a reasonable level. But despite all of that, I want to point our attention towards the 7-day moving average case counts, which is still currently close to 45 cases a day, which is still the highest compared to what we have seen in the first wave. So I don't want people to get different messages. We have to look at the reality as well, that this is what we are dealing with. The good news is it's all going in the right direction, but we also have to see that this number is still higher than what we have seen at the peak of our first wave. This slide compares our Windsor-Essex region compared to Ontario, and on the what we can see that overall the cases increased in the province as well as in our region. Our province started to the case rates started to increase much earlier than our region, and then our region cases, it caught up very quickly, and now we're starting to see more improvement in our cases, even compared to the provincial decline that we are seeing across. Our cumulative cases in the region, and we're slightly seeing the flattening of the curve in our region. We have seen a huge increase in the case with a curve that was very steep, but we are starting to see some impact and some bending of the curve based on all these measures that was implemented and were followed in our region. Our cumulative death rates, we've seen, again, similar picture. We've seen a huge increase in the number of cases in the last couple of months, and now we are still seeing some cases, but those numbers are starting to decrease, but still reporting deaths every day. It's not something that we like to do. It's not something that the community should see. We definitely want to prevent all these deaths from happening in the first place. This slide captures our week-over-week incidence rate per 100,000 population, starting from week 18th to our current complete week. And when we are saying current complete week, the week typically ends in Sunday. So whatever you're looking, the data captures all the way up until that timeline. Our most recent completed week's case rate is 50.6 cases per 100,000 population. This is again a decrease once again from a week prior. But if we just, instead of looking and closing on Sunday, if we see the past 7 day, our case rate is 46.1 cases per 100,000 population. So that would be up until yesterday if we do the average instead of looking at the completed cases per week. Comparing our weekly case rates with the provincial weekly case rate and the cases in Southern Ontario, and as we can see, our case rates were significantly high compared to the rest of the province as well as for the Southern Ontario, and at the peak our case rates were close to 340 cases, which is now coming down significantly and are even below what the provincial weekly case average weekly case rates are. This graph looks at our wastewater surveillance data, and as we can see that this is again the model is still under development. It's a research project at this time, but we can still see the correlation between the data, the wastewater data versus our daily case rates. We see some fluctuation in the data, but overall it aligns very well with the with our case rates, which is a good sign that it's some kind of a validation as well that what exactly is happening in the community, and it's aligning well with the wastewater data, signifying the trend, signifying the cases that are active in the community. This figure looks at all the tests and the unique individuals tested by week in Windsor-Essex, and in total 257,290 tests were completed as of February the 6th. This is a complete week ending on a Saturday. For the week ending on February 6th, our person positivity at that time was 2.6%. And last week, approximately 8,905 tests were completed. The slide looks at the most recent 7 days worth of results, and then the most 7 days are preliminary and are subject to change because we have to look at all the data, all sources of testing that's coming up, and include that in our analysis. So that's what it looks like. But if we just focus on the past 7 days, Windsor-Essex has the 6th highest person positivity in Ontario, sitting at 3.1%. This is a decrease from the last week when it was 4.3%. So overall, again, there was a time when our person positivity was the highest in the province, and we are starting to see that shift that our region is moving in the right direction, and our person positivity still is high, where sitting at 3%, and we'd like to definitely see that coming down below less than 2%. Breaking it down from person positivity by age group, and similar picture, we've seen a huge difference in terms of the younger population in early December and early January, but all of these person positivity data are coming together and aligning with each other for the most part. Looking at our person positivity by the forward sortation area to just identify if there are any specific hotspot, any specific neighborhood that we can identify based on their person positivity data. What we can see right now is the data which is from February 3rd to February 9th. And all the areas that are showing a darker shade, that means the person positivity in that particular FSA is higher compared to the rest of the region. This graph looks at the percentages of test results that are available within 1 day and 2 days of someone getting tested using a 7-day average, and approximately 51% of tests are being processed with results available within 1 day of being tested for our region. Within 2 days of tested, 95.2% of the tests are being processed with the results available. So those numbers are slightly down from the last week, but still it's in a much better position where we were before, when we were barely getting between 10 to 20% of the results back in just 1 day. So how do we compare about the when it comes to receiving the results within 1 day across Ontario based on the 7-day moving average? We're somewhere close to the middle of the pack for how long it's taking us to get the result. Similar picture when we're taking a number of days to receive test results once it's sent to the lab is also somewhere in the middle for all of us, for our region, sorry. Looking at the regional and provincial rates, and this is the cumulative case rates for since the beginning of this pandemic. So because of our high case rates per population, we still are at the second highest regional and provincial rates. Our region has the second highest rates in the province of Ontario. Looking further in terms of the rate by municipality, and this is a cumulative picture starting right from the time when we had our first case all the way up to recent timeline, and we can see that the municipality of Leamington and Kingsville had the highest case rates, and majority of those cases are in the temporary foreign workers and the agri-farm sectors, and that's why we are seeing that high number is still sustaining, and then followed by City of Windsor, Tecumseh, Essex, and the rest of the municipalities. A similar picture from February 1 to present. Leamington continues to have the highest case rate. The only notable exception is the township of Essex, where we have seen in the last 10 days or 11 days, the case rates increasing at a higher rate compared to the rest of the region, something that we are monitoring, and we just want to present that data as well. Overall distribution of COVID-19 cases by municipality. This is again overall picture where Windsor contributing to almost 54% of our overall cases, and then Leamington and Kingsville, the rest of the municipalities are pretty much at the same overall case rates. Just in the last month, similar picture, no changes. Windsor, Leamington, and Kingsville continue to lead the pack, while the rest of the municipalities are pretty much at the same level. In the last 7 days, as I mentioned, the similar picture, nothing significantly different from what we presented before. When it comes to age and sex distribution of the people who are getting COVID, we are starting to see a decline in the cases between 20 to 29, and not much difference with the rest of the population brackets. But what we are starting to see is an increase in the case rates in the seniors population 60 and older, and partly because of some of the ongoing outbreaks that are happening in the long-term care home and retirement home, contributing to the number of cases in the region compared to the rest of the community. Looking at our non-epidemiologically linked cases, or you can say about community transmission, currently using a 7-day average, we see that 20.6% of our cases do not know how they acquired the case, so which is equating to 1 in 5 individuals acquiring the disease without having any identified source of exposure. So which is again something that we need to be mindful of as a community, that there are ongoing community transmission, and we have to take appropriate precaution when we are connecting with anyone else or out in the community. From an exposure history perspective, this is what it looks like. We have seen a large number of cases in the month of December. In January, cases are starting to decrease, and majority of these cases are continuing to be linked with the household contacts and or a result of close contact, but we are also seeing some community spread as well. And very few travel-related cases we are also noticing. So this is just a breakdown and looking much more closer from February to present, similar exposure data, and it gives you a breakdown of majority of the cases, where they're coming from, and day-to-day variation. Despite the day-to-day variation, most of these are as a result of household contact. Breaking this data down by the municipalities, starting from January to present, similar picture, and we can see that the majority of the cases in Kingsville area and Leamington area are linked to outbreak, whereas pretty much every community, we can see the majority of the cases are coming from the household contact and as a result of close contact. The number of outbreaks, active outbreaks in the region, there was a time at the peak when we even crossed 50 active outbreaks, and now we're trending down. Today, as we reported, 19 active outbreaks in the region. From a hospitalization and ICU perspective, we've seen a significant peak, but now we are starting to see a decline. The number of ICU cases continue to still stay at a higher level where we would like to see, but overall the hospitalization is decreasing, which is a good sign for our community. Looking at our day-to-day COVID-19 admission by date, we have seen some fluctuation, but overall the trend is going downwards and moving in the right direction. When it comes to acute inpatient occupancy, and despite the decline in the COVID-related cases, we can see that the acute care hospital system continue to have large number of inpatient occupancy to meet the need of the community, and any pressures, any additional cases, any significant spike in the number of COVID cases can create more challenges in the hospital system with respect to its capacity. ICU occupancy, I already touched on that overall the ICU and the vented bed capacity is still at a higher level and than we'd like to see. So overall, when we're looking at the outcomes, what we can see is more than 95% of the cases are resolved. Unfortunately, 2.8% of those who acquired COVID in our region have lost their life. And right now, 1.5% of individuals are currently self-isolating. Day-over-day deaths that we report, and as we have reported, mentioned a few times, that there are the deaths that we are reporting, that it didn't necessarily happen in yesterday. There may be some delay in reporting, so day-over-day deaths are reported here in this particular graph. Age and sex breakdown of COVID-19 deaths, and as we can see, 96% of our deaths happen in individuals between the ages of 60 plus, and the rest of the 4% in the younger population. And as we know, that it's not necessarily the seniors that we need to be concerned about when the community cases are increasing. It affects everyone, and we have seen people dying even in the younger age group, and how it can impact the high number of cases, the community overall. Looking at our day-over-day doubling time, as we can see that our rates are now improving and increasing for compared to the province as well as for Canada, and we are moving in the right direction. Looking at the median are not effective, which is currently now standing at 0.76. We have seen some slight fluctuation from the last week and a slight increase from last week, but overall it still is less than 1. Day over day, our weekly variation is expected, but overall it continues to stay in the right direction and below 1, which is showing a decline in the overall transmission in the community. So in summary of all that data, the case rate in Windsor-Essex continues to decline. Our acquisition sources are still between household contacts and close contacts mainly. And with the outbreaks trending down in our region, we expect to see more and more improvement in our region. Still, we have 1 in 5 individuals acquiring disease through community transmission. So there's an ongoing community transmission that's happening, and it's important for people when they are out to be mindful of that community transmission and take appropriate precaution. COVID-related hospitalization continue to decline in our region, and the number of outbreaks is also declining. Day-over-day doubling time in Windsor-Essex is again, it's better than the Ontario and the province. So in summary, in terms of the monitoring indicators for Windsor-Essex, our weekly case rate currently stands at 46.1 cases per 100,000 population. So please note that this is a standardized rate. This is not a moving average. This is a week-to-week calculation of weekly case rate and standardized at 100,000 population. When we are looking at the percent positivity, our percent positivity for the last week that was completed is 2.6%, and our R effective is 0.76. So based on that, the criteria for red control zone, which includes any weekly case rates of 40 or more, so we are above that criteria. So, and then percent positivity of 2.5 or more, so we are also above that criteria. And then the R effective is 1.2 or more, so our R effective is better than what the criteria is for red control. So all this data and information is available to the province, and they will be looking at that data, and they will be making a decision based on that data, which we are expecting would be released sometime today. Thank you. Before I finish and we take questions, just want to remind that Monday is Family Day, and we will not have any YouTube session on that day. We will resume our transmission on Tuesday.
We'll now take questions from the media. Today we'll start with CTV.
Yes, good morning. So it appears case counts and other indicators are close to the red zone, but does the local presence of the variant also complicate that decision?
Well, definitely, this is something that we are aware of. We know the province is also interested in looking at that data and making sure that the variant of concern is not posing a significant risk in our community. So the province is aware of our case. We have provided and shared the information with respect to our investigation. So we don't know at this time how it would impact our decision, but at this point we also know that the medical officer of health, the chief medical officer of health in consultation with the local medical officer of health, do have the ability to put a pause and put a break in the reopening if the indicators suddenly start to go to turn into the wrong direction. So let's hope that doesn't happen, and we continue to see ongoing decline in our community, and this case that we have identified will resolve without resulting in any further transmission.
And do you think, even though that we are slightly over the indicators, that we should still be in the red zone next week?
Well, those are the criteria that if our numbers are higher than that. So for example, our number is 46, and the criteria is for the red zone is for the weekly case rate to be higher than 40. So yeah, I think it has to be high to be in that control zone, and we are there in that from a data perspective. This is the quantitative data that we are looking at, but there are also some qualitative data with respect to what's happening in the community, any particular concerns with respect to outbreaks, any concerns with the hospital capacity, the health system capacity, public health capacity, and everything else that goes into the qualitative assessment of the data.
Okay, thank you.
Any questions from CBC?
Hi, good morning. Based on the most recent numbers, it looks like we could maybe meet the criteria for the orange zone soon if the current trend continues. So I wanted to ask, is there a set time frame for each region to stay in each stage? Just wondering if you can elaborate on how we move through those stages.
Well, the data from all of these stages, the data is looked at by the province at all time, and we definitely provide those information along with any of the qualitative data that we provide to the ministry. To our understanding is, if the data is showing concerns or trend which is posing risk to the community, we can easily move up the criteria from a restriction perspective. We know also that whatever implementation, whatever restriction that comes into play, the impact of it, it could take up to 2 weeks to show. So we also need to know that, let's say, if the province make a decision to move us into the red zone, and then what would be the impact of that red zone, we can only see after 2 to 3 weeks of being in that category, rather than seeing an impact immediately or in the next 7 days. So I don't know when that next assessment would happen, but I would anticipate that it may take at least 2 weeks for them to look at the data again, especially if they want to ease some of those restrictions. But if the data already starts to show the sign that it's worsening, we may have we may move to a stricter criteria sooner than later.
Okay, thank you. I also wanted to ask and get your reaction to the modeling that was released yesterday by the province. They concluded that the UK variant would become dominant, and that continuation of the stay-at-home order could stop a third wave from occurring. I'm wondering what's your reaction to that modeling, and does it stack up to what you expect to see locally?
Well, I think if the transmission continues to happen, we will continue to see maybe the mutations happening locally, as well as some of the other mutation that is already identified and showing up in our community. So the key in all of that is to keep the transmission low, and the only way we can keep the transmission low is to follow public health measures. When these measures and restrictions are put in place, it helps to reduce the opportunity for people to come together, reduce the opportunity for the virus to transmit from one person to another. And if we can keep it that way, we can keep the overall transmission, the likelihood of getting these variants of concern in our community would be low. But if that changes, we'll definitely will be in a situation where we will start to see more and more transmission happening through this variant strain, and putting the community at risk.
Thank you.
Any questions from Blackburn?
Yesterday I spoke with the Minister of Procurement, who said that she had a talk with some of the local health officials about preparing for a large increase of vaccine delivery. Can you just tell me if you're part of that call, and if you were, what impression did you get from her?
Well, the meeting was arranged by one of our MP, Eric Kushmarchek, and it was a great call with the minister yesterday. We were able to identify some unique challenges, some unique innovative ways that we have dealt with COVID, and identifying some of the challenges with respect to the border, with respect to temporary foreign workers, with respect to some of the procurement challenges that we have seen. So we were able to share that. The minister did talk to us about the plans, that how much of vaccines that the government of Canada will be bringing in, and wanted to hear our perspective, our approaches, that how we plan to roll it out in our region. And overall, it was a great meeting. She liked the work that we have done, and we are looking forward to continue to work with our federal partners as well to support our community in the best possible way.
And from what she told you, do you feel prepared for what's coming?
I think so. There's a lot of work that's been happening right now with the province, with the local partnership, with the vaccine rollout plans and strategies. We need some support from the province in helping us shape how our strategy is rolling out in our community, and we hope that before we start to see more vaccine coming our way, we'll have all of those things sorted out, and we will be ready to vaccinate our community as quickly as possible.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Are we still seeing a decline in cases, or are case counts leveling out? It seems to be holding fairly steady, though it is fluctuating day to day.
Yeah, so we are still seeing, you're right, we're still seeing cases between, fluctuating between 20 and 40 cases a day, which is, again, it does highlight that we still have some sustained ongoing transmission happening in our community, and we definitely need to break that chain of transmission, and we want to make sure that people don't see that in a different way. We still have a significant number of cases. We're still, and as I shared in my graph, our weekly case rate is still higher than what we had at the peak of our first wave. So don't forget that fact that where we were before and where we are right now. Obviously, there's a lot more things in place. There's a lot more resources and support out there for to manage all these cases, to contain it in a quick manner. But please, we need our community support to keep these numbers down, and we can only do that whatever happens with the easing of restrictions, we need everyone's support. We want people to follow the public health guidelines, and that's the only way we can keep the cases and everyone safe.
And 1 in 5 cases being attributed to community transmission having no epi-link, that seems high to me. Can I get your reaction to that figure?
Well, we have typically seen this number fluctuate between 15% to 25% of overall cases, and so that's the function. It is high. I'm not saying that it's not high, but we have seen throughout the pandemic that it fluctuates between that timeline. When we were improving, I would say late August or early August timeline, when we had cases in single digits. That was the time when most of our cases were identified with as a result of close contact or household contact with very or no community transmission cases. But when you have 20 or 20 plus cases in the community daily, you would expect to see that there would be a significant number of community transmission cases happening. And my advice again is we can only prevent that from happening if everyone is following these guidelines. Stay home if you're sick. Do not meet anyone. Do not come in close contact with anyone who you do not live with. And when you are out, make sure that you are wearing a cloth mask and washing your hands frequently with soap and water or using alcohol-based hand sanitizer, and go out only when you need to. It's not at the time that we have to get together. It's not a time to have parties. It's still, we need to act as a community and look after each other in the best possible way.
Thank you.
Any questions from AM 800?
Dr. Ahmed, just following up to what you just said, obviously with Family Day weekend here and Valentine's Day, what is your message to the public?
Well, it's especially with the family day. We, as a family, I will be planning to connect with my family virtually, making sure that we bring that family spirit and stay in contact with everyone. But definitely, please do not try to meet in person, and not only from a public health advice perspective, but I also want to remind that the stay-at-home order is also in place. So please make sure that you are taking all these precautions. You're keeping everyone safe. And I think that includes also your family, close family members. People sometimes do not show symptoms immediately when they are infectious. You can be infectious and you can still not show symptom, but the next day or the day after, you can start to exhibit symptoms. And then you cannot go back and fix what you have done. So you have to remember that there is a risk. You definitely don't want to put your loved ones at risk by meeting them. You also don't want to get together with your friends and other families and to put them at risk, especially if there's any seniors and elderly in that group. It can be a death sentence for them. So just be mindful of what you're doing and stay safe and keep everyone safe.
Is there concerns out there from yourself and the health unit if the general community, the population sees how our numbers are going down, they might ease up a bit on some of the restrictions?
Well, I do worry about that, and that's why I want to give out a clear message that yes, the numbers are going down, but our case rates are still high. It's not where we like to see. So we definitely don't want to ignore the fact that how quickly it got worse in November and December. We don't want that. Nobody wants that. We don't want to be in a situation where the province put us in lockdown again, and everything that we have built so far with reducing the transmission and keeping everyone safe, it will all just go down the drain. So we definitely don't want to do that. We want people to understand that it's a fine balance between the risk that we have and the fine balance between your social, mental, economic well-being. And we all have to act together as a community to support each other, to support everyone, and to keep everyone safe.
Thank you.
Any further questions from CTV?
No, thank you.
CBC?
Yes, I do have one more question. I read recently that about 10% of Michigan's population has received a first dose of the vaccine. So I wanted to ask about the disparity in the availability of vaccines on this side of the border. I'm wondering, what could it mean for our region if we continue to lag behind when it comes to immunization?
Well, I think this question should better be directed to our federal government and the provincial government. Locally, my goal is I want to get everyone vaccinated as soon as possible, and it doesn't matter if they're vaccinated 10% or 20% or even 1%. I want my community to get vaccination as soon as possible. If we get the vaccine, we want to get them vaccinated in as soon as possible, like in a month or 2 months timeline. The supply is a challenge, and that's why we are trying to make the best plans, make the best use of the available vaccine, that it should go to the right people to save lives, and then overall, in the long run, keep all of our community members safe. So I do feel that we are falling behind with respect to vaccine supply, and we want those vaccine supply to come to us as quickly as possible to keep our community safe.
Thank you.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
No, thank you.
AMA 100?
Dr. Ahmed, just in regards to the color system, were you consulted this time around, or did they just look at our numbers?
I did had a conversation with our Chief Medical Officer of Health, and I was able to share our data. I was able to provide additional context, details, some of the qualitative information about our community. So that conversation did happen.
Thank you. Have a great weekend.
Thank you.
Thank you, everyone. Our next broadcast will be on Tuesday, February 16th.